Your health certainly does matter. I am sitting in studio with Dr. Rorisang Mathibe, who is a specialist, a dermatologist, and he's back again to kind of give us insight when it comes to eczema, right? So, Dr. Mathibe, Dumela, and welcome to UFA.
Morning.
How
Good
are
morning
you?
to the viewers. I'm good.
Great.
It's cold, but
Hey,
what can we say?
what can we say? We must just go with the seasons, right?
Definitely.
Yeah, let's do that. Let's go with the
Sure.
seasons. I want us to actually talk about eczema today. What exactly is eczema?
Yes.
And what are the primary causes of this skin condition?
The skin condition. Yes. Eczema. It's one of the common conditions we see in dermatology,
Oh.
especially at this time of the year.
Mm.
So we also call it dermatitis. So
Okay.
which just simply means inflammation of the skin. You know. So we've got different types of eczema. We've got what we call atopic eczema,
Okay.
which is one of the common ones we see in dermatology.
Mm-hmm.
We've got what we call steatotic eczema.
Mm-hmm.
We've got what we call seborrheic eczema, and we've got also contact eczema or contact dermatitis.
Okay.
So all these are eczemas, but most of the time, when somebody says eczema, we assume that you're just talking about atopic eczema because that's the commonest we see in dermatology.
Okay. So you've just mentioned the different types of,
Yeah.
of eczema. What
Yeah.
are the some of the signs, the symptoms, I suppose, as well as the treatments of
Yeah.
these different types of eczema?
Okay, so let's start with the commonest, which
Yeah.
is the atopic eczema. Atopic eczema is that one that will, all of them actually, they will present with itchy skin.
Mm-hmm.
But atopic eczema will also be associated with what we call xerosis, which is also known as dry skin. And the skin will be itchy in those flexural areas. And then in babies or infants, you'll see the cheeks most of the time presenting with an itchy rash. It can even affect your knees as well, what we call it the extensors. So most of the time it's dryness,
Mm-hmm.
an itchy rash, and it's chronic, remember, because there is that genetic aspect of it.
Okay.
And there are also environmental factors that will trigger eczema in those that have a genetic predisposition.
Yeah, talking about triggers, what
Mm.
are, some of the common triggers that can actually worsen eczema symptoms, right?
Yeah.
And how can actually individuals identify
Yes.
and even avoid, because that's the
Definitely.
biggest, we need to
Yeah.
avoid them. How do we do that?
And a lot of people are still not gonna like me.
Okay, all right, let's see, let's hear.
So like I said, that we're talking about a genetic condition.
Yeah.
So mainly what's happening on the skin is that they have more of a disrupted barrier. Remember, the skin is supposed to be the barrier that keeps what's inside and what keeps what's outside.
Yeah.
So people with eczema, there are certain proteins that they don't have, that they can't produce naturally, that make their skin barrier to be susceptible to environmental triggers. So what triggers are we talking about? Number one, we're talking about fragrances. Even last week, we
Yeah.
did talk about fragrances. Mainly, we call them allergens. We're talking about detergents, soaps, We're talking about rough cotton. If you wear woolly clothes,
Yeah.
those would also irritate your skin. So constantly, when you get in contact with this allergens or triggers in a genetically predisposed individual, you're going to have this recurrent rashes and itchy skin that will come and go. Yeah.
What are some of the most effective treatment options when it comes to eczema? Whether this is over the counter or it is, prescribed.
All right.
Yeah.
Let's start with the over-the-counter and what people can do at home.
Okay.
So what is very important, like I said, that is to understand that your skin is very sensitive.
Yep.
So when you buy over the counter, you need to look for ingredients that will be hydrating your skin and will be relieving the dryness that is most of the time associated with the eczema. So look for ingredients that talk about glycerin. Why do we want glycerin? Is because, like I said, it has an ability to attract water.
Yeah.
So we want those ingredients that will keep your skin hydrated, especially in winter. Look for ingredients that talk about urea. And actually, urea is one of the proteins that the skin produces naturally. But in individuals with atopic eczema, some of them, they can't produce what we call natural moisturizing factors.
Yeah.
And urea is one of them. So even when you buy skin products or moisturizers or lotions, look for things that talk about natural moisturizing factors. Also look for what we call hyaluronic acid, which is now a trending ingredient that we'll talk about most of the time, that also has an ability to attract water and keep your skin hydrated. And then you look for products that talk about emollients, ceramides. Ceramides are fatty acids or fats that your skin produce naturally, but with people with eczema, again, they lack an ability to produce those ceramides. So nowadays we've got even moisturizers that will talk about ceramides. So those fats, when you apply them, they actually try and create a very intact barrier so that it can protect you from some of these allergens that you get in contact with in the environment.
Yeah. All right. Okay.
Yeah.
Can you quickly just also provide us with some tips, right, on how individuals that are struggling with eczema can actually manage their condition on a daily basis?
Yes.
This can be, of course, through lifestyle changes, maybe the food that they're, consuming, maybe
Definitely.
stress management as well,
Definitely.
even skincare routines as well.
Definitely. Yeah. So it is important to understand that hot water also will remove all these small little amounts of ceramides that your skin probably had produced. So bathing once a day is enough for someone with eczema, especially in winter. So we would even advise you that your bath shouldn't take more than 10 minutes.
Yeah.
Okay. Lukewarm water is the best way to go. Avoid perfumes and fragrances in the house. Avoid air conditioners in the house. As long as it has a fragrance, it will irritate your skin. Moisturize. Keep your skin moisturized, because as soon as it's dry, you're going to itch, and when you scratch, that scratching will trigger eczema. So I think some of these over-the-counter products that I talked about that will have ceramides, it's things that you need to put every day. And then I'm not saying that over the counter it's the only option for you. You still need to go and see your dermatologist, because we need to assess the severity of your eczema, and there are prescription medications that we can add on to the stuff that you buy over the counter that you will use to calm down that itchiness, because when you are itchy and you scratch every day, it can even affect your sleeping patterns. And some people, it has been proven scientifically that when you've got itchy skin the whole day, you can't function properly. You can even end up with mental disorders because of insomnia and inability to function with the pruritus. And with social stigmata, people, when you see someone scratching already, you think, they are not bathing properly. These ones, only to find out it's associated with the eczema itself. So those are things that even as dermatologists, when you come into our offices, we'll try and relieve the itching, we'll try and relieve the dryness, and we'll try and relieve that red rash that you have together with these ingredients that I spoke about.
Yeah, I mean, with every illness or with every condition that people experience, they tend to evolve with time.
Yes.
So are there any maybe, new emerging, treatments that are there that can be quite effective now?
Definitely.
All right,
Definitely.
share them with us.
So in the olden days, even now still, we use drugs that are called steroids. Most of the time we use what we call topical steroids. But nowadays we have what we call steroid sparing drugs that will almost do a similar job like steroids. And the main thing is to calm down your inflammation, because that's what's driving the eczema. So nowadays with technology, we even have what we call biologics that don't actually suppress your all of your immune system. It will actually suppress the chemical that is produced only in eczema. So we call them biologics. They are very effective, but because South Africa is a developing country, we don't have them available readily. We usually give them to people that we can't control with the typical treatment that we'll use for eczema, like topical steroids. When we see that you're not responding, we will introduce things like biologics that work effectively, and they even maintain that good lifestyle that you want. You find that you get one injection every month, and it controls your eczema throughout the month.
Oh, okay.
So that's what's coming out now in medicine and dermatology.
Yeah.
Definitely.
All right. Can I get, before you go, this is my last question too. Can I get your opinion on non-fragranced petroleum jelly? Because now it's the season for petroleum jelly, right? So are we allowed? Is it okay if you, especially if you're struggling with eczema, to put that on?
Definitely. We need that to seal in the moisture.
Okay.
So petroleum jelly is what seals the moisture. A lot of people will come and say, Doc, I'm using Aquas cream, but I applied now, 2 hours later I'm dry.
Yeah.
And then I have to reapply.
Yeah.
So what I will usually say with them is that look at Aquas cream as something that has water. Right? When you walk out, that water will evaporate. But if you had applied something watery and you seal it with an ointment like petroleum jelly, then that will help prolonging that hydration on your skin. So petroleum jelly, I definitely agree with you. You need to use it.
Yay! So here we go with petroleum jelly. We continue with it. Thank you. Thank you,
Definitely.
Dr. Rorisang Mathibe, for joining us.
It's a pleasure.
Thank you.
Sure.
That is, of course, Dr. Rorisang Mathibe, who's a specialist dermatologist, and we just had that conversation about all things that have to do with eczema. I do hope that we managed to assist you. But yeah, you know, we struggle with it, especially during the winter season. I don't know why, but yeah, we struggle with it, and hopefully that you get. I hope that you get the help that you need where that is concerned. Otherwise, it's Your Health Matters on a Monday.
An ailment is one too many, so we're bringing the health experts closer to you. Your Health Matters.